Good afternoon, everyone. Thanks for joining our monthly healthcare provider briefing webinar, where we share relevant public health updates regarding COVID-19. My name is Dr. Cindy Shen. I'm a public health physician at York Region Public Health, and I'll be presenting this webinar with my colleague, Dr. Mavish Mehrani, who is also a physician here. As always, a very big thank you to our team who helped put this together: Anastasia, Brooke, Emily, Umar, and our corporate communications partners. Next slide, please. So a few housekeeping items to note before we start. This is a live stream, and you can share any questions or thoughts you may have using the chat box, and we'll be closely monitoring these. We'll go through the presentation first, but should have some time in the end to address your questions. If we don't have time to answer everything, any outstanding questions will be collated and answers will be sent out in a Q&A document through Public Health Matters. So please make sure you subscribe to this. We'll also share the slides after the webinar as well. This meeting will be recorded. Although your name will not appear on the screen to attendees, producers and presenters may have access to that information. If you have any questions about the recording of this webinar, please contact Liaison at the email address noted here. Next slide. So to ask a question, you can click on the Q&A icon on the right side of the screen. You can then type your question in the compose box and select send. Questions will be screened by the moderator and posed to the presenters. You would not be able to see each other's comment, but we will keep track for you. And as mentioned, we'll try to get through as many questions as possible, and answers to any outstanding ones will be sent through Public Health Matters afterwards. Next slide, please. We would also like to learn about you, so things like your profession, location of work, whether you have participated in these past webinars, and also your preferences in terms of timing of these webinars and any feedback you may have. So we would really appreciate it if you could complete a very short survey. You can access the survey by clicking on the Q&A icon, followed by the link that has been posted there. And of course, you can complete this at any point during the webinar today. Next slide. So this is what we'll be going over today. We'll start with an epidemiological update for York Region, then discuss the variants of concern, some vaccine-related updates, and also other updates from the province and from our region. Next slide, please. So let's start with some epidemiological updates. This is the epidemic curve of confirmed COVID-19 cases in York Region. And as you can see, starting in September, we had an increase in the number of reported cases. However, the number of cases appears to have peaked in January, and since then, there has been a decline in the number of confirmed cases. And the latest 7-day average of new cases that we had was 105. Next slide, please. Similarly, there was a decrease in the number of hospitalizations after the peak in January. So the number of severe cases also appears to have decreased. Next slide. In addition, we had a reduction in the number of outbreaks reported. In particular, the number of outbreaks has decreased in the institutions, including long-term care homes and retirement homes, and also in workplaces. And of course, in-person instruction in schools only recently resumed, so the situation is being monitored very carefully. Next slide, please. And we're also paying close attention to variants of concern, or VOCs. The way the lab test works is that there is an initial screening test for the N501Y mutation in the S gene, which is associated with all 3 variants of concern. And I'll speak more about these on the next slide. And then essentially the specimens with this particular mutation would then undergo genomic sequencing for the specific VOC classification. So far, York Region has received 416 VOC cases. Of these, 70 have been sequenced and have all been the B117 variant, which was the one originally identified in the United Kingdom. The other specimens either have not yet been sequenced, given time required to complete sequencing, or they were detected earlier on before routine sequencing started in early February. So we know that B.1.1.7 variant is circulating in the region, and we've been monitoring the situation very carefully, including looking at the doubling time, cumulative cases, and proportion of cases. And so far, there does not seem to be a rapid growth or explosive growth of these variants. Next slide, please. So to provide you with a bit more information about these variants, we know that viruses generally acquire mutations over time, which lead to new variants that differ from the wild-type virus. Sometimes new variants emerge and disappear, other times variants stay around. And over 4,000 SARS-CoV-2 variants have been identified in the world, and most of these are not of concern. That being said, there are also these variants of concern, or VOCs, which contain one or more mutations for which there's either conclusive or strong evidence that it will have an impact on public health or clinical practice, including transmission, virulence, and vaccine efficacy. So far, 3 VOCs have been identified, and these are listed here. So these are the B.1.1.7 variant, which was first reported in the United Kingdom back in September, and since then have been found in more than 90 countries. The B.1.351 variant, which was first identified in South Africa in October and has been found in close to 50 countries since then. And lastly, the P.1 variant that was first identified in Brazil back in December, and since then has been identified in more than 20 countries. So all 3 variants have been reported in Canada and in Ontario, and most of these in Canada and in this province are of the B.1.1.7 type. And as mentioned, that this was also the only variant that has been identified so far in our region. However, the B.1.351 variant has been identified elsewhere in Ontario, including in Peel region, as you may have heard. And the first P.1 variant case was identified in Toronto earlier this month, and this particular case had a history of travel to Brazil. And at yesterday's COVID-19 science table presentation, it was reported that the province had a total of 11 B.1.351 variant cases and 2 P.1 variant cases. So as mentioned, all 3 variants of concern share the N501Y mutation, which is detected by the screening test. Each also has a number of other key mutations that have public health implications. For instance, all 3 variants have the D614G mutation, which lab evidence has shown may spread more quickly than the wild-type virus. In addition, B.1.1.3.5 and P.1 variants share the E484K mutation, which may affect neutralization by some antibodies and possibly increase the risk of reinfection and vaccine escape. So for all 3 variants, the concern is increased transmissibility, and there's growing international evidence on increased transmissibility for all 3 variants. So there's real concern about their impact on the number of cases overall and also potential strain on healthcare resources. Also, experts in the UK reported that the B.1.1.7 variant may be associated with an increased risk of death compared to others, but more studies are needed to confirm this finding. For the B.1.1.3.5 and P.1 variants, another concern is the possible risk of vaccine escape and reinfection. There were preliminary studies done related to vaccine efficacy of the B.1.1.3.5 variant, and a few reports suggesting the possibility of reinfection with the P.1 variant. But of course, additional studies are needed. And on the other hand, so far the evidence is suggesting that existing vaccines seem to provide protection against the B.1.1.7 variant, which is the more common type found here in Ontario. And of course, the evidence is always emerging, so our knowledge of these variants will continue to evolve as well. Next slide, please. Due to the concerns about these variants, the Ontario government released a 6-point plan at the end of January to help stop the spread of the new variants. So this plan includes mandatory testing of travelers, enhanced screening and sequencing by the lab network, leveraging data by establishing genomics data bank and analytics dashboard to guide planning, enhancing protection for vulnerable populations by accelerating vaccination of priority groups and expanding rapid testing, both of which we'll touch on shortly as well. And also included is having public health measures in place, which really brings me to the point that even though we have decreased case counts and outbreaks overall, we really can't let our guard down. The same measures that are required to reduce transmission of these variants of concern, but what's needed is really more rigorous application of these measures. So we all need to continue staying home as much as possible and wearing a mask for any essential visits and maintaining physical distancing. We hope that if you're asked about these measures by your patients or colleagues or family members, anybody in the community, that you could help share the same messages. And in the healthcare setting in particular, the appropriate use of personal protective equipment is especially important for reducing the risk of transmission, along with the other IPAC measures, of course. And last but not least, strengthening case and contact management is crucial. Next slide, please. So the Ministry of Health issued interim guidance for enhanced case and contact management, recognizing concerns related to these variants. The guidance is being applied to all confirmed and probable cases of COVID-19, including any VOC screen positive cases. So following the ministry guidance, York Region Public Health is performing enhanced identification of contacts, so having a lower threshold for identifying contacts as high risk and requiring quarantine. There are also recommendations for enhanced asymptomatic testing, so testing any high-risk contacts immediately to facilitate identification of cases, and then retesting them on or after day 10 if they were tested too early. In addition, retesting if at any point they become symptomatic. Household contacts of high-risk contacts are also asked to stay home except for essential reasons while the contact is quarantining. And these household members include those that the contact lives with and those with whom similar interactions occur. So for instance, a caregiver would also count as a household member. There's also additional guidance related to enhanced and prioritized case management for VOC screen positive cases and enhanced outbreak management for all high priority risk settings, which include healthcare settings, congregate living settings, and schools. Next slide, please. So that was a bit of information on variants of concern. So now we'll provide you with some updates on vaccines. In York Region, a COVID-19 vaccine task force was established in January, and members include representatives from multiple sectors in the region, including primary care, Ontario Health, hospitals, pharmacies, social services, interfaith communities, paramedic services, fire services, and others. So the purpose of the task force is to support mass immunization planning and coordination of distribution in line with the province's prioritization, applying a system-level approach and also applying an ethical framework. This group meets twice per week, and 2 working groups have been established to support decisions about how vaccines are distributed for priority populations in the community and also for healthcare workers. Next slide. So as you know, the province sets priorities and targets for vaccine rollout, and there are multiple phases to the plan. Phase 1 includes congregate living for seniors, healthcare workers, adults in First Nations, Métis, and Inuit populations, chronic home care recipients, and adults aged 80 years and older. York Region Public Health has been working with various partners, including those on the task force, to plan and implement vaccination programs. And we have offered vaccines already to those in our long-term care homes and retirement homes, and the highest priority healthcare workers. And more recently, also to the very high priority healthcare workers. You may also have heard about the plan that appointment booking for those aged 80 years and older will begin on March 1st. The specific details are being finalized, and the plan is to communicate the information when it becomes available through various channels, including on our own website at york.ca/COVID-19 vaccine, through various news outlets, senior groups, and also through primary care if there's capacity to also help disseminate that message. Next slide, please. So you may have seen this healthcare worker prioritization guidance document, which was released earlier this month by the Ministry of Health. This guidance was created based on an assessment of the risk of exposure, patient population served, and incidence of outbreaks. York Region Public Health has partnered with Mackenzie Health and South Lake Regional Health Center to vaccinate healthcare workers in the highest and very high priority groups. And many healthcare workers are in the very high priority groups, including those in primary care, pharmacy, and dentistry. It's also helpful to note that the definition of healthcare worker is broad and includes any frontline patient-facing workers, including custodial, security, and reception staff. So any eligible healthcare worker who live or work in York Region could access the COVID-19 vaccine, and information on how to book a vaccination appointment can be found in the memos that were shared through the various colleges and other avenues. So please book an appointment to get vaccinated, and also speak to your colleagues about getting vaccinated. And of course, it's important to continue following public health measures, including wearing the proper PPEs, even after receiving the vaccine. Next slide, please. So when it comes to vaccination, healthcare providers also play a crucial role in reporting adverse events following immunization, or AAFEs. As you know, AAFE reporting is an important part of post-marketing surveillance for vaccine safety. And AAFE is an unwanted or unexpected health effect that happens after someone receives the vaccine, which may or may not be caused by the vaccine. So submitting a report does not mean that the vaccine caused the event itself. Healthcare providers are required to report AAFEs to York Region Public Health under the Health Promotion and Protection Act. Vaccine recipients or their caregivers may also voluntarily report AAFEs to public health. So to report an AAFE, you simply complete the Ontario AAFE reporting form, and you can download it at the link here and then fax it to us, or you can call Health Connection at the number provided here. For more information, you can also visit York Region's webpage on COVID-19 information for health professionals linked here. Next slide, please. So there are a couple of helpful documents from Public Health Ontario about AAFEs as well. The first one is a fact sheet on AAFE reporting, which outlines the type of adverse events that are reportable, including the specific temporal criteria involved. And it's important to know that for each event, there are estimated timelines between vaccination and symptom onset that, if met, would need to be reported. Other events not listed on the form can also be reported if they are deemed clinically significant. Of particular importance are those that require medical consultation or that are unusual or unexpected. On the other hand, it's also important to note that certain mild or common events do not need to be reported. For instance, fever that is not accompanied by any other APHEs, as is a common reaction, injection site reactions that last less than 4 days, vasovagal syncope without any injury, and events that are clearly attributed to other causes. You can refer to the fact sheet for more information. The other thing to note is that the current APHE reporting form includes a specific section on adverse events of special interest for COVID-19 vaccine, and almost all are physician diagnosed. And the second PHO document listed here describe these further, so you can take a look. Next slide, please. You may also receive questions about allergies. The Ministry of Health has a document on vaccine recommendations for special populations, which includes recommendations on when allergists or immunologist referrals are needed. NACI also has some related information. To help address allergy-related questions, there is a new web-based allergy advice service for COVID-19 vaccine. Through the Ontario eConsult service, physicians and nurse practitioners can now ask for advice regarding allergies and the COVID-19 vaccine from allergy and clinical immunology specialists. This service is made available by the Ontario eConsult Centre for Excellence in partnership with Public Health, the OMA, Ministry of Health, and others. And here are a couple of links that you can use to sign up for eConsult and to also learn more about this service. Next slide. So besides getting vaccinated yourselves and being a role model, we also know that healthcare providers are the most trusted source of vaccine information. So you can certainly play a role in instilling vaccine confidence. And here are a number of resources that can help you do that. We have the COVID-19 vaccine website, in addition to a video, a fact sheet, and other resources that are being developed as well. You can share these widely. In addition, vaccine was the main topic in the January webinar, and the slides are available online if you want to take a look. Also, the Ministry of Health has a fact sheet which answers some of the commonly asked questions. And so you can access all of these wonderful resources through these links posted here. Next slide. So next, Dr. Mehrani will speak to some additional COVID-19 related updates. This is also my cue to remind you to please fill out a survey by clicking on the Q&A icon, followed by the link provided. Avish?
Thank you. So a couple of updates. First of all, we want to start with the potential new vaccine that was actually just approved today by Health Canada. The primary analysis, so this is the AstraZeneca vaccine. Primary analysis of phase 3 clinical trials from the UK, Brazil, and South Africa support that the AstraZeneca vaccine candidate is safe and effective at preventing COVID-19 with no severe cases and no hospitalizations reported. In terms of vaccine efficacy, after the first dose, it's about 76%, and after about the second dose, it is about 82%. As many of you are probably aware, Canada has now approved the AstraZeneca vaccine, and we should be receiving doses very soon. Effectiveness against the variants of concern, however, has not yet been determined. Next slide, please. Also, as a reminder, York Region recently moved into the red zone. I'm not going to go into the specifics of the red zone, but I just want to take this moment to remind everyone that we should continue to be vigilant and remind our patients that we should be continuing to take extra precaution as we still see cases of COVID in the community, and remind everybody of the importance of keeping masks and all your other protective equipment around. Next slide, please. Now as well, we have the York Region schools are open and a lot of students have returned. If you do encounter a patient who has questions, you can refer them to this COVID-19 school and child care screening tool. There is still a Ministry of COVID-19 school and child care screening tool, but we certainly recommend that you can use ours. We may transition back to a ministry tool at a later date. The most important thing to remember that's different than before is that now we are going based on a one symptom presentation. So if there's a student with even one symptom, we ask that that student and that student's siblings and household members self-isolate until it can be determined what the next steps are, which are often testing and determining risk exposure. So please do take the time to review the back to school screening tools as they have changed from the previous ones. Next slide. If you do have a patient who needs to isolate and is unable to do so safely in their home, there are voluntary isolation centers. So all cases and close contacts should be advised of the availability of the voluntary isolation center during investigations. Eligibility criteria is someone who's waiting for their COVID-19 test results, someone who has tested positive or is a likely COVID-19 positive case, and any close contacts. For more information, you can give your patients this information. They can self-refer by calling the following number or email York Region. And there is a website below for more information. Next slide, please. Finally, as a reminder, if you are trying to access lab results for your patients in regards to the COVID-19, you can use Connecting Ontario, the clinical viewer, which will provide that information, which are often connected to your electronic medical record as well, or the OLIS system, which will also provide COVID-19 lab test results. Next slide, please. So I'm going to pass it back to Dr. Shen to discuss these documents.
Thank you, Dr. Mirani, or Mavish, as I like to call you. So just a few things here. There were a number of ministry documents that were updated last week, specifically information related to the rapid testing or point of care testing were added to these documents, and they are listed here. Next slide, please. So just a few quick notes about the point of care testing. There are two types of point of care tests. There is the rapid molecular test, which is used for diagnostic or screening purposes. And there's the rapid antigen test that is only used for screening purposes and not to be used for diagnosing an infection. The rapid molecular test has been used in more rural and remote areas where lab-based PCR tests will be difficult or where the turnaround time is above the target. On the other hand, the rapid antigen test, as you may know, is being used for asymptomatic screening of staff and visitors in long-term care homes and in schools, for instance. So it's important to note that the antigen test is only used for asymptomatic people with no known exposure to a case and who are not part of an outbreak. So those who are symptomatic or contact of a case still need to get the lab-based PCR test at an assessment center or at a participating community lab. Screening does not replace public health measure recommended, of course, so physical distancing and PPEs are still needed. And when it comes to the rapid antigen test, any positive test is considered a preliminary positive and must be confirmed by lab-based testing. So all point of care preliminary positives must be reported to the local public health unit. And this is because any preliminary positives will be treated as a probable case. So the relevant case and contact management would be done, and the preliminary positive case and their close contacts would need to isolate accordingly. The testing guidance also provided some new information on the province's targeted testing groups. It also provided additional information on testing of patients transferred between facilities, which may be of interest. So essentially, at a minimum, any patient should be tested upon admission to a destination facility, even within the same multi-site organization. And for those to be transferred to a long-term care home or retirement home and those entering a residential treatment facility, additional testing requirements would apply. Next slide, please. So that concludes the presentation portion of the webinar. Now we can take a look at the questions that you have posted. So there was a question about the New York and California variants and are they in Canada? And so I understand that there's been reports of another type of variant. I think it's, I'm trying to look up the specific name of that or the specific strain. But essentially, we haven't received any information about that particular variant in Ontario, to my knowledge. And I understand that we're still trying to learn more about these variants and if there are any concerns associated with them. So we're always, learning about new things come our way. So if there is additional information related to this, or if this is detected in Ontario, we'll certainly share all that information in future webinars. So the next one is, I thought test time of symptomatic, asymptomatic close contacts, I presume that's the question, was after 5 days, not 10. So that's a really good question. Essentially, the ideal timing would be day 5 to 7, and that was the direction in previous guidance. That being said, because of the VOC being more transmissible, the idea is to really test sooner rather than later to identify any additional cases. And if they were tested, let's say before day 7, then repeat testing at day 10 would be helpful just to further provide reassurance that that person remains non-infectious or not a case. So I hope that that clarifies that part. And you can feel free to take a look at the VOC interim guidance from the province that's posted on the Ministry of Health website. They have a particular web page for healthcare sectors and the guidance related to healthcare sectors. So that's where you will be able to find that information. So I'm looking here. I understand that there were a few comments here about patients calling clinics asking for direction about vaccination. And also another question about when or how family physicians' offices will be informed. So as mentioned, the communication is being worked on and the details are being finalized, and when that information becomes available, it would be conveyed through a variety of ways, including to primary care. I think there was also a similar question about providing this through the OMA, and I think that comment has been addressed already as well, that we did in fact use that as an avenue of communicating with physicians or primary care physicians. There was a question about priority for family members of healthcare workers who are in the highest level of priority. That's an interesting question. And so as mentioned, the task force here is working together and following really the prioritization set out by the province. And so that information is actually available on the province's website if you want to take a look at the different phases and who would be able to receive vaccines during those phases. That's a helpful resource to look at. There was a question about breastfeeding and receiving the vaccine. So as mentioned, the Ministry of Health did publish recommendations for special populations, including pregnant women and also those who are breastfeeding. So that would be a helpful resource to look up. And I understand that there may also be a new e-consult service that was just shared through either, I believe it was OMA this morning, about additional e-consult service related to pregnant women, and so that might be another resource to use as well. So the other question is about, right, okay, so more comments, and really appreciate and welcome all the enthusiasm as well about how you can assist to the patients in booking the appointment. So again, that information will be shared as soon as it becomes available. And again, another website to pay attention to is again our COVID-19 vaccine website on our York Region website. That's where your patients and yourself could get additional updated information as well. So there was a question about a patient who had COVID and can they have the vaccine? So we're looking at the National Advisory on Immunization guidance document. It's not a contraindication for resolved cases to receive the vaccine. So certainly they can be immunized. The concern when it comes to COVID cases is more about the symptoms associated with COVID and potential similarity with symptoms associated with immunization. So if they're they're active and they have symptoms, it's ideal to wait. But generally speaking, you are able to vaccinate resolved cases. That being said, if the supply is limited, then the recommendation from NACI is to maybe immunize other groups before the resolved, if there's limited supply. And sorry, I'm just having a bit of technical difficulty scrolling. And can caregivers of patients over the age of 80 also receive vaccination when it's offered in mid-March? So as I mentioned earlier, the vaccine or vaccination appointments can start to be scheduled actually the 1st of March, so that's good news. The provincial system will be available in mid-March, but we are getting started earlier than that because we want to make sure to vaccinate as soon as we can. With regard to your question about caregivers for patients over the age of 80, currently for the appointments that will start to be booked on the 1st, my understanding is really the priority group that we're really focusing on is those who are actually over the age of 80. Good question about the caregivers then, though. I am sure that this is something that the province along with the task force are looking at as well, and work is certainly being done on that front with regard to additional prioritization. What is the turnaround time from positive swab to detection of the variants and the timing of the specific typing of variants? So that's a really good question. Generally speaking, the information we've been provided by Public Health Ontario Labs is that it takes about 2 to 3 days to complete the VOC screen. So that is the test for that particular mutation that's shared among the variants. The timing to the actual genome sequencing will take a bit longer, maybe a couple weeks. I think the PHO lab would have the most up-to-date information related to the timing, however. And of course, that depends, that has a lot of other factors that play into this as well. Okay, there was another question about with the increased transmissibility of VOC, does this change the period of isolation for those who test positive for VOC, like longer than 10 days? So far the guidance is suggesting to continue with the isolation period of 10 days for all cases, and I have not seen any changes related to this. But of course, we're continuing to learn about these new variants, and we'll just have to keep a close eye on any additional guidance coming from the province when it comes to any case or contact management. So there was a question about vaccination and quarantine after travel. So the Public Health Agency of Canada actually provides information related to quarantine after travel and all the testing required and all that. So I think that's a good resource or organization to look to for that direction. And I know that we only have 5 minutes left, so I'm just trying to see if there's any new. So I answered the turnaround time question. Where is the rapid antigen test available? That is a good question. So the Ministry of Health is working on a program for rapid antigen testing, and there should be more information on their website. They're starting to look at, of course, long-term care home and retirement home, but also essential workplaces. And so it would be helpful to look to them for that direction. And again, there's actually a specific guidance document that was included in the list earlier on about considerations for antigen testing, and there are specific measures, or rather communication process, that needs to be in place for those workplaces that actually implement antigen screening. So again, that is a helpful resource to turn to. So I recognize that we are at 12:56. I know that there may be a few additional questions, so what we'll do is, as mentioned, we'll compile any additional information that have additional questions that have not been addressed, and then we'll send that out through a Q&A document afterwards. Okay, next slide, please. So before we wrap up, we just wanted to share a few additional general resources that may be helpful for you. Again, you can subscribe to the Public Health Matters to receive future invitations to these webinars, the slides for today's webinar, and other resources. You can do this by going to york.ca/health-professionals and clicking on e-newsletter for healthcare professionals. Please also spread the word and encourage your colleagues to sign up for this. Next slide, please. There are also a number of links that you may find helpful. So the general healthcare providers page on our website, our COVID-19 page, which has the latest information, including epidemiological information. And again, here's the adverse event following vaccination form. And also there's the Ministry of Health website, which I had mentioned earlier, that has up-to-date provincial guidance documents for the healthcare sector. Next slide, please. So I think that concludes today's webinar. Thanks so much for joining, and thank you for all your questions and comments. And we will communicate through Public Health Matters afterwards. And thank you again, and hope you have a good day.